The mortality rate for victims of COVID-19, particularly those who were confirmed positive after death, has prompted a formal agreement between the National Forensic Science Service and Central America Health Sciences University. The Memorandum of Understanding signed by both parties ensures that forensic autopsies can be done at this facility, amid growing concerns of exposure by employees at the Carl Huchner Memorial Hospital.
The need for a secure space to conduct forensic autopsies was highlighted last year because of the COVID-19 pandemic. We actually, in 2020, conducted over 60% of all our autopsies or post-mortem exams here at the Cashew Morgue. That was the first year, 2020 was the first year where majority of our post-mortems were done here. Prior to that, all the post-mortems were done at the Carl Huchner Memorial Hospital morgue. Obviously, because of concerns about staff becoming infected, about concerns with contact with COVID-positive cadavers and high traffic of individuals, we stood to benefit a lot from using this space at Cashew.
The Belize Medical College will also benefit from the MOU, since students will now be able to sit in on postmortems related to medical legal death investigations. For the Health Science University, access to fresh cadavers simply means cutting the cost of having to import from the United States.
In the past, we used to bring cadavers mainly from the US at a high expense and logistically difficult to bring, and then we have to return the body 1 or 2 years after. Now we have the opportunity of having fresh bodies in country where students can come look for us and participate eventually in dissection of the human body. And so that was one of the main reasons why we were encouraged to enter into this agreement with the Forensic Services of Belize.
For the National Forensic Science Service, the idea of an official partnership came out of a visit from several experts attached to the International Narcotics and Law Enforcement Affairs section of the U.S. Embassy. Together, they identified Cashew's facility as the most suitable for conducting these types of autopsies.
The morgue here, or what Cashew calls the anatomy lab, was identified as one of the more ideal locations to conduct autopsies, given the space requirements, given the facilities. So that was decided back in 2018, that was recommended. And as part of this institution, the Cashew efforts at becoming accredited, also as part of the National Forensic Science Service long-term plan of attaining accreditation, such informal relationships need to be formalized, in this case as an MOU.
Administration Manager Keishalyn Belizaire says the partnership, despite not being legally binding, allows CASU to fulfill the requirements of its accreditation process.
One of our key components of our charter requires that we satisfy affiliation with government agencies, none more better than the forensic department. As Mr. Cho had rightly said, it provides educational expertise for students. So that's our number one benefit, as well as it satisfies our ongoing accreditation process.
Reporting for News 5, I am Isani Cayetano.